Hello, my name's Alex Estrell. I'm going to be doing my clinical for community health at the Edna and John W. Mosley School in Arapahoe County. So Arapahoe County is very large. You can see from the map by 2030, it'll have a population of about 779,000 people. It is primarily white, and I kind of did the breakdown there. 8% live at or below the poverty line, which is scary, but it is below the national average. One of the major assets I saw was just doing some basic research online, and that's the county public health website. I thought it was very informative, very user friendly. You can see at the bottom there, they offer a lot of different specific things that people can click on to get more specific resources relevant to them. Those include sexual health matters, immunization information, the Women, Infant, and Children program. So overall, I thought this was a great benefit, at least to the population that has internet access. And then another asset was in public spaces. So I drove to the Aurora Sports Park on a Sunday about 2, and it was absolutely packed. People of all ages were walking around, being active. I drove past the Highline Canal Trail, Utah Park. Even just driving around the neighborhoods close to the school, there was a lot of neighborhood parks with playgrounds sort of dispersed throughout the community. One of the challenges I noticed and got some information on was mental health concerns, which is interesting because it's not necessarily a concern that you would see just by driving through a community. But in 2017, the percentage of high school students that had considered attempting suicide or had attempted suicide was 18.2% and 7.9%, which was higher than the state average in both instances. That's high school students. Suicide rates were the highest in those aged 45 to 64, so the older adults. And even though we're going to be interacting with middle schoolers, I think it's a great opportunity to sort of start this conversation early, provide education, and link them with resources to sort of hopefully prevent these numbers from going up or even decrease them. This is a great graph that shows specifically for Arapahoe County the major reasons people didn't seek mental health care was cost of treatment, difficulty getting an appointment, and people thinking that insurance would cover it. So I think it just points to the fact that there needs to be not only an increase in the resources that are available and the quality of those resources, but also just educating the public on what resources are out there so that those resources can be utilized correctly and efficiently. Another challenge I saw was that of the home environment and how that affects a population's overall health. One issue related to this is financial strain. So this graph just kind of shows that median household income in Arapahoe County really has not gone up that much in the past few years, but the median home value has gone up substantially, which means that people are going to have to sort of settle for homes that maybe have poor air quality, closer to highways where there's a lot of pollution. And then racial bias is also a major issue. You can see here that white individuals are denied home loan applications at a much lower rate than minority populations. So again, this points to the same thing where people may have to settle for homes that are worth less. So in maybe worse areas or with worse air quality. There was a survey or study done in the Tri-County area, which includes Arapahoe County, and roughly half of the homes that were inspected had radon levels above the recommended limit, which just you know dramatically increases your risk for chronic disease throughout your life, specifically respiratory issues. So home environment is very important, and it's a challenge that needs to be addressed. Kind of leads into my next point here. One thing that I was not expecting was kind of how drastic of a change you get with just a 5 or 10 minute drive. So I took all four of these pictures. The top left is an intersection. You can see the sidewalk is really just gravel. It doesn't even go the whole length of the road. This is farther away from the school versus right across from the school is that picture on the upper right, and it's a well manicured lawn. Sidewalk is taken care of, easily wheelchair accessible. And then those bottom two pictures, kind of show the same thing. The bottom left, it's still an open space, but it's really not the type of place that you're going to see kids running around and playing versus close to the school. That's a neighborhood park in one of the neighborhoods close by. And it's very, kid friendly. You can definitely see kids going there on their time off and being active, which just points to a lack of equal resource opportunities based on where you live within that community. Based on the four components, the first one I'm going to focus on is community vitality. So close to the school, I saw a lot of people walking around, walking dogs, riding bikes, running. That Aurora Sports Park, again, was full of families and young children and older adults. But the farther you go away, the kind of less vibrant the community becomes. Fewer people I saw. Really, the only people I saw outside far away were waiting at the bus stop, and those were few and far between. And then overall, people appeared generally healthy. You can't really tell everybody's complete physical history just by looking at them, but they did appear generally healthy. The second component is indicators of social and economic conditions. So the areas, again, surrounding the school were well manicured. They were dense with food and gas options, a lot of open spaces, a lot of green. I took this picture here. There's political signs on a lot of the street corners, which just shows that um, they want their population to be invested in the community and the issues that the community faces. Largely single-family homes, a lot of apartment complexes, and then the farther out you go, sort of the more rundown the buildings get. It was largely trailer homes, a lot less chain restaurants and well-known things. There was a lot of locally owned restaurants, and then the bus stops really varied throughout the where I drove. Some were clean and covered, others were just benches sitting out in the sun. So it really was kind of different with what appeared to me, no real rhyme or reason. And then I didn't really see any groups of people accumulating in the streets in any of those places. The third component that I'm going to focus on is health resources. So again, the county website's a great resource. Just one little snippet here that I took. I think it's for the WIC offices, and there's a lot of different opportunities or offices there that people can see what's closest to them. The Aurora East Clinic has walk-ins 2 to 3 times a week, so you don't even need an appointment, which is nice for lower free or low-cost immunizations. The Medical Center of Aurora is a 346-bed acute care unit. Swedish Medical Center is there. It's a 408-bed acute care hospital. The websites just do a great job of kind of separating them based on what their specialties are, so people get an idea of kind of what's available close to them. And then the fourth component that I'm going to focus on is environmental conditions. Sort of touched on all these, but the roads were well taken care of. There weren't really many potholes. Traffic lights were all functioning. Again, the sidewalk conditions varied based on where I drove. Restaurants and grocery stores definitely more prevalent the closer I was to the school, and then a lot of small parks dispersed. My overall takeaway is that even within a community, individuals can differ on their access and quality of care. So we look at community statistics kind of as an um, overall picture of the population. But when you're treating a patient, it's important to remember to think of them as a unique individual with unique needs. And a solution that works for one person might not be the best for another patient. So it's important to be aware of the many different needs that a individual within a population might have. These are just some references. Thank you.